2.0 plan is simply a reminder that we're heading into a new season, a new year. Kids are coming back to school, our hospitals are overstretched, and so we wanted to amplify the policies that have been working thus far and also analyze where we're going next. So let's look at the data. It's not a wave like the waves of the past, and we can talk about this. The numbers, the cases do continue to rise. There's no disputing statewide our numbers per 100,000, which is really the best way to analyze what is the true picture of what's going on. Statewide, it's 271 cases per 100,000. And you can see the chart here that just continues to go up from where we were just early in November. So we have 76,000 positive cases today, 76,555 cases today. It's almost not worth it to say we're breaking records. We're breaking records every day, and we'll probably continue to do so until we hit that downward trend, which we hope happens sooner than later. But we don't have a lot of precedent other than looking at what's happened in a few other places. But it's also important to put this in the context of what New York has experienced in relation to the other states. The trend is identical. Washington, D.C., where my children live, and are always conscious of the impact of this on their lives, and I hear what's going on in D.C. all the time. New York, New Jersey, Puerto Rico, Rhode Island, Florida, Illinois, Maryland, Massachusetts, and Connecticut. This is happening everywhere. And so just to remind New Yorkers that we're not unique in this. We are being hit very hard without a doubt, but this is also a national phenomenon, a global phenomenon, in fact. And also, we are testing more. That's one of the reasons we're seeing high numbers, and that is a good thing. It is a good thing that we have so many test kits and locations and availability of tests all over. And in terms of where we are with respect to the rest of the nation, we're number 3 in the country for per capita testing, number 1 in the large states, which is incredible. If you compare us to some of the smaller ones, they might be a little bit ahead of us, but you look at the larger states, and we are doing a really good job in terms of getting testing out. We can always do more, and this is all according to Johns Hopkins University, which is tracking the trends. So we are testing more without a doubt. A priority of our administration. We've executed it, and now we have the results to show. So our hospitalizations continue to rise, closing on 8,000, which is not a milestone we hope to hit, but it's also very concerning. We know that hospitalizations are putting a lot of stress on an already overtaxed healthcare system. Again, I had a chance to go out and meet some people in the North Country, from Plattsburgh and Potsdam and Watertown, really just to go and engage to the leaders of the hospitals, what they're going through, the nurses in the emergency rooms, the doctors, the line nurses, the people who clean the rooms. I mean, it's just been such an exhausting experience for so many, and they're frustrated. You ask anyone in healthcare right now who works in a hospital, and they know it did not have to be this way. If we had more people vaccinated, fully vaccinated, to deal with this highly transmittable variant known as Omicron. So those are our numbers. You can see the positivity, individuals in the hospital, the number of people who are COVID patients in hospitals by region right there. New York City, nearly 4,000 hospitalized with COVID right now, putting a lot of stress on our systems. And sadly, yesterday we lost 80 New Yorkers, closing out a very tumultuous, challenging year for all families, but particularly the families that had to say goodbye to someone they cared about. And it's got to be heartbreaking to lose someone anytime, but certainly over the holidays, and our hearts go out to all of them. So you can, again, put it in context of where we were, our 7-day average, where we were last January, again, a very high percentage of deaths. We are seeing more cases, but not the correlating number of deaths, which is a good number. This is the snapshot we have right now. And the sooner we can start the downward trend of this spike, will also I'm sure the deaths will decline right now. But we're not out of it. I'm not here to say we're out of this. We are still addressing a very serious situation. We also continue to monitor what's happened elsewhere, places like South Africa, where Omicron was identified before anywhere else. We saw how hard it hit. All eyes of the world were watching what happened there, and also wondering when it was going to stop going upward. And the data from the South African Health Department showed that they passed their peak and without a major spike in deaths, and they're continuing to decline. So we don't have a guarantee that this is our future, but it sure looks optimistic in terms of how quickly the numbers decline after a major spike, which is what we're going through right now. So we're watching South Africa as well as the other countries that have gone before us. Also, we know how to get through this. It's been about vaccinations. And if you think back to March of 2020, and we are first told that the way out of this pandemic, which is all new to everyone, was to have vaccinations, but they normally would take 2 to 4 years to develop, even on a rapid pace. The ingenuity and the brilliance of our medical teams and our doctors and people who work for the pharmaceutical companies, they got it done with support from the federal government. So we've had available since this time last year, literally remember a year ago, we were vaccinating people in nursing homes and in congregate settings, the most vulnerable people among us. We wanted to make sure they're vaccinated first, and then our essential workers, and then getting down to people by age. So we have a very, very high number of individuals who got the first dose, one of the highest in the country. So we have 95% of adults over 18 have had a first dose. I don't want that to plateau. That still has more room to grow. But what are people waiting for with that second dose? You are not protected with one dose. This variant breaks through a first dose and even a second dose, and that's why we're going to continue focusing on boosters. So also with a booster shot, people say, well, how long is it going to take? And is it worth getting a booster right now? Yes, you can be protected within 2 to 3 days of receiving that booster shot. That's incredible. You don't have to wait as long as we had to wait in the past for the vaccines to really be fully effective. 2 to 3 days, that's all it takes. And our challenge to continue to be, when you look at the numbers here, there is no reason that that is at 28% of 5 to 11-year-olds getting their first dose. Parents, I've asked you during this break, you're possibly home with the kids, someone's watching the kids, get them out to the many sites. There is no reason why anybody in the state of New York cannot get their arms jabbed with a vaccine. It's been available, easy, the information's out there. We'll continue to provide it on our websites, continue to work with our local partners, but those numbers should be jumping much higher than they are, especially in the context of what Dr. Bassett will talk about, the number of children being affected by this virus. So the answer lies right before us. It is so clear. It is right there. Get every age eligible, particularly your children, because your children, your 5 and 7-year-old who are eligible to be vaccinated, might actually be the ones who transmit it to your 2-year-old or your 3-year-old or your 4-year-old. This is going on in your own home if we don't take the steps necessary to protect every child that is eligible for a vaccination, and that is